Hi, and welcome to the informational video webinar series on the rules for certified child care centers. This is video number 3, covering policies, emergency preparedness, items available to view, and notifications. My name is Crystal Percy. I work for the Child Care Licensing Division as a regional manager for the Eugene and Medford units. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new Certified Child Care Center rule set. During each video in the series, we will explain some of the key features and highlights of the Certified Center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Child Care Center Rulebook for the full list of requirements and rules. Okay, let's get started. Let's look at policies first. As a Certified Child Care Center, you must have written policies. These policies can be printed on paper or kept electronically, as long as they are provided to all staff and volunteers when they are hired, and anytime they are changed. These policies must also be given to parents at the time of enrollment and when they are changed. There is a section in the new rulebook that lists all of the required policies. Each certified child care center should review the full list and make sure they have written policies for each of the listed topics. Covering all of these policies in staff, volunteer, and parent handbooks will make it much easier for everyone to review and refer to them later. Child Care Licensing Division has created a document that lists the required policies for certified child care centers. It has been organized and formatted in a way that you can use it as a checklist as well. You can request this document from your licensing specialist or find it on our website. Many of the policies are ones that you already have, but there might be some that you need to create. Some of the policies on the list include safety measures, including safe sleep practices, monitoring of sleeping infants, injury prevention, use of pesticides and other potentially toxic substances, animals, water activities, and prohibited substances. Also, you will need a center-sponsored religious and cultural activities policy, if any, including how holidays will be recognized. This policy supports transparent communication between the program and families. Parents that know more about the program's activities and celebrations are able to make choices about whether the program is a good fit for their family. Additionally, you'll need a communication methods and notifications policy, including how parent grievances, questions, or concerns are handled by the center. Another example is a center philosophy on how children learn and develop, and how this philosophy is implemented. Now let's talk about emergency preparedness and response. One of the policies required for certified child care centers is an emergency preparedness plan. You may already have a plan like this, but the new rules require that the plan must identify a licensed physician, hospital, or clinic to be used for emergency medical care. It must also include the plan for evacuating children to a designated safe area or relocating children to an alternate shelter. Designated safe areas and alternative shelters must be a minimum of 50 feet from the building being evacuated. A new aspect regarding emergency plans is how a certified child care center will observe weather conditions and other possible hazards to take appropriate action for the children's health and safety. These weather conditions include outdoor temperatures over 100 degrees or under 20 degrees, storms, and flooding. Other hazards of concerns are earthquakes, an air quality emergency ordered by a local, state, or federal authority on air quality or public health, and police guidance to go into a lockdown. It's important that child care programs have a plan for emergency situations. Include in your plan where to find this information and warnings in your area, what actions you will take, and how you plan to keep parents informed. A certified child care center must have a portable emergency light source, such as a flashlight, in working condition and available in each classroom or area used by children, the center's kitchen, and the center's office, if applicable. A cell phone flashlight can be used to meet this requirement. A certified child care center must have an emergency supply kit in a location that is known to all staff. At a minimum, supplies must include the following: first aid supplies, hand sanitizer, wet wipes, and tissue, a whistle or air horn, a working flashlight and spare batteries, and a battery or solar-powered radio. You can have additional items in your kit, but these items are required to be in the kit at all times. Next, we will cover the items you need to have available to view. A certified child care center must have specific items available in an easily seen and frequently visited location for families and the public to view. This can be met by a bulletin board located in the entryway. It can also be met by most items being stored in a binder that is available for parents and families to view. Typically, a great option for locating the binder would be near where parents sign their children in and out, as long as the items are available and easy to view. There are a few items that must be posted in a prominent and frequently visited place rather than in the binder. All serious valid complaints and serious noncompliance letters must be posted for 12 calendar months from the date of the letter. Also, a notice of any current or pending legal sanctions must be posted immediately and while in effect, including throughout any appeal period. Each classroom must also have a few things posted. These items are emergency numbers, including the center name and address, the emergency evacuation and relocation diagram near the entrance or exit of the room, a program daily schedule, the menu and children's dietary restrictions, known allergies, and nutrition requirements must be posted in a location easily accessible for staff, but not available to those who are not parents or guardians of the enrolled child. And a new posting is the applicable ratios and group sizes for the ages of children in that classroom. We will now talk about notifications. These next few slides have a lot of information on them about what and when you need to notify Child Care Licensing Division or parents. There is a document that your licensing specialist can give you that lists all of these items. You will also be able to find this form on our website. A certified child care center must notify Child Care Licensing Division, or CCLD, by 5 p.m. the next business day of the following items: a change of director, a change in mailing address when different from the physical address, a change in phone number, a known legal action or child abuse and neglect investigation, such as an arrest, criminal investigation or charge, or victim protection order involving any person for which a certified child care center is required to request a background check, and an unscheduled temporary or permanent center closure or relocation. Additional notifications that must be made to CCLD by 5 p.m. the next business day include an accident involving transportation unless there were no injuries and only minor damage to the vehicles, any serious injury or incident involving a child who was given the incorrect dosage of any medication, a child who took or received another person's medication, or the death of a child or staff member that occurred on the premises of the center. Further notifications include any occurrence, including a natural disaster that renders all or part of the certified child care center unsafe or unsanitary for a child, including disruption of utilities or contaminated water. An incident that exposes children to an imminent risk of harm, such as a child leaving the center without the center's knowledge or being left alone on or off-site or in a vehicle. An animal bite to an individual that occurs on-site at any time or off-site when participating in center activities. 3 more notifications include other dangers or incidents requiring emergency response, such as a fire or temporarily relocating children. Any time prohibited discipline or prohibited actions occur. Any incident where physical restraint is used. Please note that notifying CCLD of most of these incidents is not new, such as the serious injury of a child, but the time frame of by 5 p.m. the next business day is new. Other notifications that do not have a specific time frame but need to be made prior to occurring include an anticipated temporary or permanent center closing other than a scheduled closing like for summer break identified in center policy, an anticipated temporary or permanent change in location, an anticipated center change or alteration that impacts the amount of usable square footage or compliance with the requirements, and a change in center name. A certified child care center must immediately notify parents or an emergency contact if the parent cannot be reached, and document if their child does not arrive on his or her own at the center as scheduled, such as when walking to the center, is not present at the pickup location as scheduled, is involved in an incident that placed the child at risk, such as being lost, missing, or left alone on a playground, a field trip, or in a vehicle, has experienced any suspected allergic reactions, as well as the ingestion of or contact with the problem food, even if a reaction did not occur, and was not administered medication in accordance with directions. Additional immediate parent notifications include situations where their child received emergency medication for a life-threatening condition, such as epinephrine, sustains an injury that may need evaluation by a physician or any impact to a child's head, has been exposed to poison, has been fed human milk or formula intended for another child, is bitten by an animal when the skin is broken or when an evaluation by a physician may be needed, is separated from the group due to an illness, and is involved in any incident where physical restraint is used. A certified child care center must notify parents upon child pickup of daily happenings, including the infant and toddler daily records, significant changes in their child's physical or emotional state, known minor injuries such as minor cuts, scratches, and bites from other children requiring first aid treatment by employees, if their child was unsupervised at school or another location when not picked up on time, illness or infestation symptoms that developed or changed. Additional pickup time notifications include a child care restricted disease exposure from staff or another child, administration of medication for a non-life-threatening condition that is only administered as needed, an animal bite to a child, even when the skin is not broken, implemented emergency plans and procedures, except for drills, and anticipated closure of the center. Thank you for watching this video in our informational series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.